We imagine a world where people don't needlessly die from opioid overdose. Most people think about harm reduction really just by thinking about the phrase. So it's about reducing harm, so reducing injury through accidents, it's about reducing death, and it's about reducing illness. Now, we might hear about the phrase only in certain contexts, like people might think of Narcan or naloxone, which is the medication to reverse an opioid overdose. Or they might hear it in the context of syringe access. So all of this is in the drug use space, but honestly, it's all around us. In essence, harm reduction is about a rational and loving response to each other to reduce illness, death, and accident. It's not an action, it's a state of mind, it's an ethos, and that is something that really is baked in to the folks in the Comprehensive Center for Pain and Addiction and in our harm reduction research lab. And what's important about this is as simple as knowing the difference between blaming a patient for the lack of staying in treatment, for example, and looking at the system and seeing how it creates. So it's not about, why did Beth fail her methadone treatment again? We ask instead, what about the treatment? Its access, its delivery, other social determinants of health that Beth faced? What about that keeps Beth from staying in treatment? That's the difference. And so this completely flips the script when it comes to centering a patient, for example, or centering a community, to think about systems change, medical practice change, pharmacy practice change to reduce illness and death. If I have diabetes and my blood sugar is out of control, then I need medical intervention. If I have opioid use disorder and my drug use is out of control, then I need medical intervention. That's the same thing. We're trying to close the gap of belief, of social belief, and that's the work that we're doing, in addition to our science, in addition to our policy work, in addition to our education. And that's where harm reduction really fits. That's why it matters, and it's how it will transform practice of medicine and pharmacy.